Hi, today we'll be talking about hemorrhoids. What are hemorrhoids? These are basically engorged blood vessels in your bum area. Everyone is actually born with three small ones, but we start calling them hemorrhoids when you start having symptoms. So things like swelling, bleeding, pain, itchiness, prolapse, or hemorrhoids coming outside, mucus in your stool, sometimes incontinence. These are typical symptoms of hemorrhoids. You may only experience one, or you may experience all of it. There are times that you may experience it only during this occasion or intermittently. Sometimes you can experience it all the time. It really depends on each patient. Now, there are four grades of hemorrhoids. Grade 1 hemorrhoids are hemorrhoids that are only internal, they don't come outside. Grade 2 hemorrhoids are hemorrhoids that come outside, but then they go back in by itself. Grade 3 hemorrhoids are hemorrhoids that come outside, but then you actually have to manually push it back in with your finger or whatever else you're going to use. And then grade 4 hemorrhoids are hemorrhoids that are, no matter what you do, they're always outside. Obviously, grade 4 hemorrhoids or external hemorrhoids that are constantly prolapsed are the worst kinds. Now, there are a lot of treatment options available, but we'll talk about the two most common ones and then the two that we offer in the clinic. Before that, there is actually an option to do nothing. However, the natural progression of hemorrhoids is to keep getting worse over time, so it's always better to get it treated earlier rather than later. Now, usually the first line treatment for hemorrhoids, if they're not that bad, so from grade 1 to mild grade 3 hemorrhoids, is rubber band ligation and or cryotherapy or sclerotherapy. Now, what is rubber band ligation? Rubber band ligation is literally taking a rubber band and then, let's say this is your hemorrhoid, we band the hemorrhoid, and then the band will constrict that hemorrhoid, and then blood flow isn't able to occur, and then it just shrinks or falls off, and then the band also falls off. This is only successful about 60% of the time, and it has a very high recurrence rate. So while it is considered a first line treatment, it's more temporary. If repeated trials of rubber band ligation don't work, or if your hemorrhoids are too severe that rubber band ligation is not indicated or it's contraindicated, especially for grade 4 hemorrhoids, the next resort would be typically the hospital procedure called hemorrhoidectomy. Now, the two traditional hemorrhoidectomies are open or closed hemorrhoidectomies. There's longer names, but we don't need to get into that right now. These procedures tend to be very invasive. For some patients, recovery can be up to 4 months. Patients tend to be bedridden for about a couple of weeks to a month or so. Very high risk for complications too. So any kind of hemorrhoid treatment actually comes with the risk of complications. So complications like fissures, which are breaks in the skin, they're very, very painful. Fistulas, which are tracts under the skin, so you may find some drainage, leakage, and pus, infections, abscesses, blood clots, incontinence, stenosis, or your anus closing up because of the scarring. These can happen in any kind of hemorrhoid procedure, but the risk for them is a lot more increased in the hospital procedure. Now, in the traditional hemorrhoidectomy done in the hospital, typically they treat at most like 3/4 of the hemorrhoids. Hemorrhoids, especially when they start becoming symptomatic, tend to go all the way around inside. Now imagine if in the hospital they cut everything and your hemorrhoids go all the way around. With cutting comes healing and scarring. And if that scars all around, it'll close up your butt. We call that anal stenosis. This is a bigger problem than having hemorrhoids. So to prevent that from happening, they only cut 3/4. However, 3/4 is still a lot of cutting. That still puts patients at a very high risk for that stenosis. And what comes with it is also incontinence. So because of all of that, we don't actually recommend it, since there are other options available that we can provide that are a lot safer and come with a lot less risk of these complications and faster recovery time as well. So what are these two surgical procedures that we provide? The first one is called an endoscopic hemorrhoidectomy. This is covered by OHIP. It's similar to the hemorrhoidectomy done in the hospital, but it differs because we only treat a little bit at a time. Because as we learned from the hospital procedure, if we treat too much too soon, then prolonged recovery, high risk of complications, especially that stenosis. So depending on how bad your hemorrhoids are, you may only need just one cutting surgery in the clinic or repeated cutting surgeries over the course of several years. Now, we only treat a few at a time, sometimes only just one. We do like to treat the largest ones first because those typically cause patients more of their symptoms rather than, the smaller ones. So recovery from this is usually about a couple of weeks to a month. Usually just a little bit of swelling, bleeding, and pain, especially with bowel movements. Only rarely would it be severe or long lasting. In terms of risk of complications, it's a lot more safer, usually about less than 5% risk of complications. Now, depending on how bad your hemorrhoids are, again, you may only need one procedure or several procedures. For the first couple of cutting surgeries, it's not so much of an issue of the scarring and that anal stenosis. However, on the third, fourth, fifth, if ever you need that much, it does become an issue because with more cutting comes more scarring, and more scarring means your butt closing up slowly and slowly and slowly. Now, it's just something to keep in the back of your mind, especially if you require more treatments in the future. The other procedure that we can offer is something called a laser hemorrhoidoplasty. Unfortunately, since it's relatively new in Canada, or not relatively, it's quite new in Canada, and only a few doctors are able to do it, it's not covered by OHIP. There is a price range anywhere from about $1,600 to $6,400 depending on how bad your hemorrhoids are. And the good thing about it though is we're able to treat all the hemorrhoids in one go, at least the ones that we can see. What we use is something called is like a laser needle, and we just basically poke the hemorrhoids. And since it's just a needle, very minimal scarring, we're not worried about that stenosis. So that's why we can treat everything in one go. With a laser needle, we poke the hemorrhoids and then burn off the blood supply with the laser energy, and the hemorrhoids physically shrink during the procedure. Now, sometimes with bigger prolapse hemorrhoids, we can also do something called plastic surgery called mucopexia and or THD. We essentially, with these procedures, we stitch the bigger prolapse hemorrhoids higher up into the rectum and then laser it. So it's like a double treatment for bigger prolapse hemorrhoids. It really depends on the time of surgery if we need to do that or not. There are about 3 indications for cutting in the laser procedure. If there's any redundancy, so things like skin tags. Since skin tags are typically devoid of blood vessels, laser won't really do much for it, so you have to cut that out. If there's any blood clots, we do have to cut that out as well, or unroof it. And then if there are any scar tissue or fibroepithelial polyps, fibrosis, we do have to cut those out as well. But otherwise, everything else we can typically treat with a laser and or mucopexy. Recovery is a lot faster for most patients, usually about a couple of days to a couple of weeks. Again, it's only rare that it would be severe or long-lasting. In terms of complications, risk of complications is less than 2% based on current studies of the laser hemorrhoidoplasty. So it's a lot safer. But in terms of success rate or efficacy, the 3 surgical procedures actually have about the same success rate. So anywhere from 85 to 95%. That means that regardless of which one you choose, there's still a small chance that you may require surgery in the future. So because of that, we ask all of our laser patients to come back in 6 months just for a check. We just want to make sure that everything is gone. Hopefully it is. If there are residual hemorrhoids, typically we can treat it with the cutting surgery or the endoscopic hemorrhoidectomy. Usually this is all patients really need. There is an option to do repeat laser, though it's kind of an overkill for most patients. Most patients don't need it, but it is an option. So those are the treatment options available for hemorrhoids. Bye now.